Hey guys, welcome back to our channel. Let's talk about the difference between peak inspiratory pressure and plateau pressure. The pressure in the ventilator is comprised of two parts. One is resistive pressure and another one is elastic pressure. The resistive pressure is that which encountered when airflow is pushed through the airways, whereas the elastic pressure is that which inflates the lungs and the chest wall. So let's talk about the peak inspiratory pressure and plateau pressure. The peak inspiratory pressure in the ventilator circuit is related to resistive pressure, whereas plateau pressure is related to elastic pressure. The peak inspiratory pressure is the highest pressure reached during inspiration and is affected by both airway resistance and lung complaints. This peak inspiratory pressure measured in breathing circuit during inspiration. An elevated peak inspiratory pressure indicates airway resistance due to bronchosecretion or decreased lung complaints due to pulmonary edema or pneumonia. Usually, this peak inspiratory pressure is maintained less than 30 cm H2O. Then plateau pressure. The plateau pressure measured after an inspiratory pause. It reflects only lung complaints and alveolar pause. This pressure measured in the airways after an inspiratory pause, during which there is no airflow. Actually, this plateau pressure primarily reflects the pressure which is required to distend the alveoli. So, it is measurement of lung complaints. Okay, this plateau pressure is more direct indicator of alveolar pressure and it is used to assess the risk of ventilator-induced lung injury. A high plateau pressure indicates increased pressure on the alveoli and the highest risk for damage. Usually, this plateau pressure is maintained less than 30 cm of water in order to prevent lung injury. Here is a quick recap of the difference between peak inspiratory pressure and plateau pressure. The peak inspiratory pressure is measured during the highest inspiration, whereas the plateau pressure is measured after an inspiratory pause, where there is no airflow. And this peak inspiratory pressure reflects both airway resistance and lung complaints, whereas this plateau pressure reflects lung complaints and alveolar pressure. This increased peak pressure indicates increased airway resistance and decreased lung complaints, whereas this increased plateau pressure indicates highest risk for lung injury. I hope now you are understood the difference between peak inspiratory pressure and plateau pressure. If you have not watched our video on ventilator, make sure to watch it and the link is given below. Happy learning!